My name is Arfon Jones. I'm the Police and Crime Commissioner for North Wales. Part of my statutory responsibility is to reduce offending and re-offending in the North Wales police area. I've just recently introduced a new project called Checkpoint Cymru. We changed to divert low-level offenders away from the criminal justice system, and instead of dealing with the symptoms, which is their criminality, look at why they commit crime by looking at the underlying causes. Checkpoint was first introduced in Durham a few years ago and has proved successful in reducing reoffending, and I'm hoping it will have the same result here in North Wales. Basically what we do, we've employed 9 navigators, 3 for each one of our custody units, whereby the custody sergeant will identify suitable people coming into custody that could benefit from the Checkpoint programme. And then the navigators will work with them, carry out a needs assessment, and get them to sign a 4-month contract whereby they will work with them to look at why they're committing crime and what we can do to meet their needs and to stop them reoffending. We do it somewhat different to Durham. We use a programme, Adverse Childhood Experience Trauma Toolkit, because a lot of the reasons why adults commit crime is down to experiences they've had as children. So we thought we'd use this toolkit to address their needs and to provide services. We've identified a number of pathways such as mental health, substance misuse, debt, and I think there's about 8 pathways in all that we can use to help people to turn their lives around. But there is more to Checkpoint than just a diversionary scheme. We've also extended the Women's Pathfinder. In North Wales, women are sent to prison for relatively minor offences, and we would look to deal with women offenders in the community rather than send them to prison. So we work with the North Wales Women's Centre, who will work with female offenders who are very often also victims, and work with them. And there's also a drug education programme for people with recreational, who have been caught in possession of small amounts of any drug, and we'll give them an education programme to inform them of the dangers of using drugs. So it's a 3-pronged project, and hopefully within 12 months we'll be able to tell you a lot more about the results and the outcomes that we've had. Thank you very much for taking time to listen.